I think one of the nice definitions I had of health is when you have an empty medicine chest or medicine cupboard, you have well-used trainers, sneakers, and you don't know the name of your family doctor. I think that captures it very nicely. An important point to make for us is there are just two of us rolling out a strategy, implementing a strategy across the world. So having the GCC take on and in essence take over the physical activity and run it for us is fantastic, because we can do it at low cost, we can do it efficiently, effectively, and we get good summaries and it works extremely well. I think it's a great event, the GCC. It can be standalone, it can be the only thing an organisation does to promote health in the workforce amongst employees, or it can be part of a much bigger strategy. It's very easy to introduce. A lot of the work is done for you as an organisation by the GCC, and it has the potential effect, and we've seen it very often, it starts to get people to think about long-term behaviour change, and we've seen that folks are carrying on with the increased exercise levels long after the event finishes. In most cases, many cases, right through to the time the next 4-month event starts. Well, we've been fortunate to have a lot of people interested. The first year we just had 48 teams of 7 taking part, and then it grew over the next 3 years to 76 teams, 470, and last year 783 teams, which of 7 each means we were well over 5,000 of our employees taking part. It was really very impressive how many countries took part in AstraZeneca, across AstraZeneca. We had 31 last year, and those were some of the bigger countries where we have a lot of employees, like the US, UK, Sweden, Japan, but also the smaller countries for us in terms of numbers of employees, and also emerging markets. So it included Hungary, Poland, Lithuania, Romania, Mexico, a lot of countries. It was really good to see so much participation. I think the GCC has had a great impact on our employees, and it's interesting when you look at the stats at the end of event reports. In fact, 88% of those who took part in AstraZeneca said they'd had an improvement in their overall health, and 70% said they'd had an increase in their daily energy levels. And a lot of people do want to be a little leaner, a little more trim, and it was interesting that the average weight loss of those who took part was 3.9 kilograms, and that was very welcome. Well, that's interesting, because I think the GCC has a much better impact in a sense on business, or at least equivalent to the health benefits. So things like an increase in morale in the office, a significant impact on team working, on engagement, job satisfaction, productivity, and even people taking part reported taking fewer sick days. They were absent from work a lot less. It was really good last year, 2011, to win the award as the most active organisation, as awarded by the GCC, with over 1,000 organisations taking part. I think our employees took a great pride in that. In fact, I got the job of handing over the trophy to head of HR, and I said, "Do you want me to go and take it so it can go in our trophy cupboard?" And she said, "No, I'm taking it tomorrow to the board to tell them about our achievement."